Is everyone in the room muted? If you could share the disclaimer slides.
We got a bit of an echo, Michelle. Somebody's.
Is it yours, Alex? Is it that one? Oh, yeah. Nope. Sorry about that. All right. So as usual, we're just going to begin with a few disclaimers. This meeting is being recorded and live streamed on TVW. It will be shared on the State v. Blake webpage as well. So it is open to public disclosure. Please do not disclose any private or confidential information during this meeting. If you would like to provide feedback as a member of the public, there will be 10 minutes at the beginning of the meeting and then 10 more minutes near the end of the meeting reserved for public comment. Each person will have 3 minutes to provide feedback. And if you are not a committee member and would like to make a comment during a particular discussion, please simply raise your hand for facilitator awareness, and we will invite public comment on that topic before moving on to the next item. Feedback that is not provided during the meeting can be submitted via email at any time to hcaesb5476@hca.wa.gov. And with that, I will go ahead and move right into roll call. So Michael Langer is actually not able to be with us at this meeting. So Amber Leaders, are you here? Senator Dingra? Senator Braun? Representative Davis?
Good morning.
Morning. Representative Griffey? Caleb Banta-Green?
Good morning.
Good morning. Don Julian Saucier?
Good morning.
Morning. Chanel Wolf? Alexi Orr?
Morning.
Good morning. Amber Cope?
I'm here.
Good morning. Brandy Flood? Stormy Howell?
Good morning.
Morning. Chad Enright? John Hayden?
Good morning.
Good morning. Nikki Lewis?
Good morning.
Good morning. Sherry Candelario?
Good morning.
Good morning, Sherry. James Tillett? Christine Lynch?
Good morning.
Morning. Sarah Gillard?
Good morning.
Good morning, Sarah. Donnell Tanksley? I know Malika is just running a little late. Addie Adwell?
Good morning.
Morning. Kevin Ballard?
Good morning.
Good morning. Hunter McKim? And I know Curtis is not able to join today either. Representative Taylor? Representative Mossbrucker? All right, that concludes the roll call. And so I just have one announcement before moving on to some welcome statements. The Substance Use Disorder Intake Screening and Assessments Work Group has launched. They've had a couple of meetings, and the next one will be on February 21st from 9 to 10:30 a.m. And they have decided to be open to public attendance and observation. So if you would like to attend and observe those meetings, the meeting schedule, agendas, recordings, and links will be available on a new, it's called the SUDISA work group, a website for that work group. And if you would like the link before that website is up and running and shared with you all, just let me know via email or in the comments, and I'll be sure to get you an invitation to the next meeting on February 21st. And with that, I'll hand it over to Tony for some welcome statements.
Yeah, good morning, everyone. My name is Tony Walton. I am the section manager for the Adult Substance Use and Treatment section. Michael asked that I kind of prepare some welcoming statements in his absence. Just wanted to thank everyone for making time on a Monday morning to come talk about these crucial issues around our state. Over 66 people have joined, all dedicated and working towards the same goal of trying to improve the lives of individuals who use drugs. And it just aligns so much with the work that we do in the Division of Behavioral Health and Recovery, and specifically within my team. And our team works on issues related to the Substance Use Recovery Services Plan, implementing initiatives underneath the plan, as well as a lot of low barrier programs across the state focused on expanding access to medications for opioid use disorder, as well as supporting our state's contingency management reentry waiver and a reentry waiver. So just really appreciate everyone's time and the conversations that we have in these meetings. I've been viewing and supporting the work since pretty much back since State versus Blake was passed February 25th of 2021. And so just great to be here and continue to see everyone come up with new ideas and try to figure out ways to save lives and improve the lives of individuals who use drugs. It's very important to me as well as everyone else on this team, and just continue to show up, continue to bring up innovative ideas, and we'll do our best to try to respond, implement those, and have those conversations.
Thank you, Tony. And now I'll hand it over to Blake for introductions for members that were not at the last meeting. We kicked off in January just with introductions with your name, the area of representation that you have in the SURSAC, and then also sharing, if you wish, an intention or resolution that you have for the year that does not have to be related to this work, but certainly can be. So anyway, with that, I'll hand that over to Blake to facilitate.
All right, good morning. Continuing on with our list, first on it, I see we have Nikki Lewis. Nikki, are you ready to introduce yourself?
I am. Hi.
Thank you.
Thanks. I'm Nikki Lewis. I am currently the Addictions Administrator with WellPoint Washington and represent the Association of Washington Healthcare Plans. I also have lived experience having family members who have overdosed or died as a result of substance use issues. It's my intention for this year to continue to increase initiatives within my health plan, which promote access to recovery as well as life-saving interventions. Thank you so much.
Thank you. Stormy Howell.
Yes, good morning. So my name is Stormy Howell, and I am the treatment representative, the tribal representative, and I am the treatment program manager at Clallam Counseling Services with the Lower Elwha Clallam Tribe. And my intentions for this year are to help expand our program more out into the community and to be meeting our community's needs and to offer some new and innovative things. And as far as personally, to better practice self-care. So thank you.
Thank you. Tony jumping in?
No,
Michelle?
that was an accident. I was gonna try to do a little chief to that self-care comment. Good call, Stormy, and I think that's a good reminder for everyone.
All right, thank you. Brandy, you out there? Ready, Flood? All right. Well, I see Sherry. Sherry, you ready to introduce yourself? You're on mute.
Okay.
There we go. We're having a tough. Can anybody else hear Sherry? No. You want to come back? We'll come back to you. All right. Thank you. Okay. Kevin Ballard.
Well, good morning, everyone. Kind of a
Morning.
belated Happy New Year. It's good to see these concerned and active participants in SURSAC over the last the number of months that we've worked on it. It's been kind of an interesting endeavor. So I'll start off with my goals for this year. I simply would like to see the number of fatalities to SUD or fentanyl-related deaths decreased in this state. If we show a decline, then I feel like our job is moving in the right direction. I currently serve as a council member in the city of DuPont, Washington. I've been on the council now. This is my second term, and it will be my last. You know, I'm not the sort of person that wants to be a career kind of person in the ring, so to speak. But I do have some life experience, and I believe it's fairly unique because, you know, I was able to work as a volunteer in college in kind of the halfway. They used to call them halfway houses, but in the when Reagan passed along California, a lot of the people that were dealing with mental health issues were out on the streets, and a lot of substance use disorder then, but I was working with them in soup kitchens and whatnot. I transitioned into law enforcement, and I was a police officer for a number of years. So I intervened in direct back then using naloxone. So, I mean, I saw the effect of opiates on the population even back in the late 80s. I served in the military for over 23 years, but I have people in my immediate family that have suffered from overdose due to opioids. And I just feel like I kind of bring a unique perspective. I look very forward to working with you again. And thank you for the time to give an introduction.
Thank you so much. All right. I know Malika was going to be a little late. Chad Enright, you out there? I don't think I saw Chad. All right. How about Donnell Tanksley? Sherry, how's your audio?
I don't know.
A little echo.
A little bit. Let's see if we have. It's a little better.
Yeah, a little bit.
I think I'm going to pass. I do intend to stay on this, but my audio is terrible.
All right, Sherry, we'll try to catch it. We'll try to catch it next time then. Appreciate that. All right, Michelle, I think that's it for the folks that are here today. We'll catch up with Malika when she arrives. So let's go ahead and take public comments. If we have any today, if you would like to make a comment, please just raise your hand and we will call on you for 3 minutes. So any public comment this morning? You can go ahead and raise your hand in the virtual way here. Again, calling for public comment. All right, doesn't look like we have any public comment this morning, so we will go ahead and move on to walk-on items requests. Really what we're asking here for, Michelle, is other items. Folks would go ahead.
Yeah, we figured that, you know, sometimes in a meeting agenda and even in the process of sharing the agenda and getting feedback, there may be items of interest that are somewhat last minute, or that someone, you know, would like to talk about if there's time at an agenda at a meeting. And so this will be a recurring item for meetings from now on. So if there's anything that SURSAC members would like to discuss, if there's time during a meeting and want to raise that at the beginning, then we are more than happy to loop back to that. So if there's anything that any of you would like to talk about at this meeting today, now is an opportunity to raise that issue for discussion if we have time.
Thank you, Michelle. Anybody have anything they want to add on? All right, don't see anything, so we will move on to the next one rather quickly this morning. Jason McGill is going to talk about the 1115 waiver and other programs associated with reentry after incarceration. So Jason, you ready to go?
I actually just got a message from Jason that he's running a little late, so,
All right.
so we'll have to loop back with him as well. Are we ready for RNP updates?
Is Southwest on the call?
Yeah. Hi, we're on the call.
Okay, awesome, thank you.
My name's Barbara.
We'll get you in just a moment. I just want to give a few updates and we'll go right to you.
Okay.
Awesome.
Yes.
So I want to thank everybody for their patience on the RNP dashboard. As Michael shared last meeting, we have lost an esteemed colleague. He was much more than that. He was our data wizard. He was a friend. He was my friend. And now he was leading the charge on creating that dashboard, and we are now navigating on how to pick up where he left off with the rest of his data team, and ensure that this project remains a priority. We're hoping that at the next month, we can present something similar like you guys saw in October, because we won't have a full update yet on the dashboard, but we'll have something similar like we showed in the presentation in October, where we'll have the overview of the ASOs. The nice thing is that we'll be showing 2 quarters to play a little bit of catch up for quarter 3 and 4. So that will be from July through December of last year. We're also hoping to provide some updates that we've made to the dashboard since the last presentation based on the feedback from this group. We will also be having a provider and participant perspective from Greater Columbia, the BHASO. And we're also hoping to have an update on a date for when that dashboard will be live. We're trying our best to really navigate the situation, but we're hoping to have something to provide to you by next month. And with that, I'll give it to Southwest Washington.
Can you hear me? Okay. So I'm Barbara Garrier, and I am the director of the RMP programs for Southwest Washington, which include Clark County, Klickitat County, and Skamania County. And I'm not going to do a lot of presenting this morning. I brought with me Ari Badeau, who is our manager in Klickitat County of the RMP program, and Stephen Suarez and Sean, who are going to present. Sean is a participant. Stephen is one of our navigators here in Clark County. I will say that all of our counties are different. I think I've already presented that one time before to you. A lot of things are happening with the RMP programs. I'm not going to present this morning because I lost a grandson to this disease this weekend, and I'm not feeling like I can do that very well. So I'm going to introduce to you Ari. She's going to talk about Klickitat County and what's going on there, and then she can introduce Stephen and Sean. Ari?
Thanks, Barb. So my name is Ari Badeau. I'm the manager for the Klickitat County area for the Recovery Navigator program. And in our county, it's a pretty small county, and we don't have a whole lot of avenues for any recovery support services here in our area. When the Recovery Navigator program started, shortly after, we lost access to comprehensive mental health care in our area, which was where a lot of people received SUD and mental health evaluations and outpatient treatment services, counseling services. Our clinic in Klickitat County is the only one that does any sort of MAT or substance use disorder treatment, but it is only for individuals that are not involved with the courts. So anyone that's involved with probation, Department of Corrections, or anything like that, an evaluation through our clinic would not be valid. So with the Recovery Navigator program, and when I started, it really was my goal to try to build rapport to bridge that gap for our community, since we don't have anything here. So we've outreached to other communities to see if there was anyone that would be willing to build a connection with us and provide these services here in our area. So far, we've built a connection with Triumph Treatment Services in Yakima. They currently provide virtual evaluations, virtual outpatient treatment services, and expedited services into their inpatient treatment center. And they have about, I think, 7 treatment facilities in the Yakima area, which is the closest area to us. It's only about an hour away from Klickitat County. So we've worked heavily with them in the last year to try to see what services they can help bring to our community. Their services have been virtual for a while, but now they're talking about being able to come in person to build that genuine connection for those individuals and provide those assessments and outpatient treatment services here. So that's a great resource that we've tried to help build to get people that resource that really need it. We've also built a really good connection with other facilities in the Yakima area, because that is the closest area to us for traveling. There's Merit Treatment Services in Yakima that we built a good rapport with. We can get people in for evaluations and assessments and outpatient treatment services through Merit if somebody's wanting that avenue for themselves. And then in the Vancouver area, we've partnered with Rainier Springs and Lifeline Connections to get people into detox. Since we're 2 hours away from Vancouver, it's not easy for somebody to get into detox. Vancouver or Yakima are our 2 closest facilities for somebody to get into detox treatment. So an ambulance isn't going to transport that far for anybody who's needing detox services. So we are able to get a direct hospital transfer from our hospital to the Vancouver hospital and transport that individual to receive those detox services at Rainier Springs in Vancouver or in the Yakima area, whichever direction they're wanting to go in. And Lifeline Connections from Vancouver has made it a point to try to come to Klickitat County once a week to provide assessments, evaluations, and outpatient treatment services. So they come to our White Salmon area, and they're there every Friday to try to bridge that gap and help get our county some recovery services. And we definitely take people over to White Salmon to get those evaluations. White Salmon is only about 30 minutes away, so it's definitely a lot more accessible to be able to do that when somebody's needing that resource. So with what I'm doing, I'm really just trying to access whatever recovery services are out there and link these individuals to those recovery resources, because our county unfortunately doesn't have a lot of them. So that's kind of what we're doing with the Recovery Navigator program in Klickitat County. So, Steve, your turn.
Yes, hello, everybody. My name is Steven Suarez. I am one of a team of urban recovery navigators here in Vancouver, Washington. I have Sean Prasad with me here. Sean is a law enforcement referral back from 11/2 of 2022. A coworker of mine went out to meet with Sean, and he communicated with us his needs. We navigated him towards detox, into inpatient treatment, into recovery housing. Sean wanted to go a step further and build the relationship back with his family, his mom and dad. So he moved back in for a while. And then Sean empowered himself to move back into recovery housing, pursue recovery coaching, pursue certified peer counseling certificates, and get into the field of recovery. And now Sean is employed at Vancouver, Washington's first safe stay, Outsiders Inn Outpost. With that, I will turn it over to Sean.
Hello, everybody. Good morning. My name is Sean Prasad. It's my first time doing a meeting like this, so forgive me if I make any mistakes. But I have a year and some time, almost year and a half of recovery under my belt, sobriety, and it's all due with the recovery navigators. I mean, I was out there on the streets, and you know, like Steven said, I was a law enforcement referral. He came in and really helped navigate me into Lifeline, which is where I started my detox. He got me housing. And prior to that, you know, working with him, he had gotten me into a hotel through the horrible weather that we were having. And he bought me food so I can cook. Just the amount of help that he was able to provide was really, it was more than reassuring that I was going to be able to stay on the path of recovery and have somebody to help navigate me through the whole way until I was able to at least step in my own 2 feet and keep walking. And I still am here with Steven, you know, so I'll never let the navigators go. I'm gonna always have them navigate me in the right way. A little bit about myself, I guess. I do work at the Outpost, the Outsiders Inn Outpost. I started there this last year in December. And it's fantastic being able to give back to the community, create more awareness about fentanyl, and the amount of harm and death that it is causing here in our community, and just to make people more aware, you know, and spread the awareness to the younger community and the kids. That's kind of my goal, and that's what I'm going to work towards as I'm fresh and new into the recovery aspect of things. That's kind of where I plan to start and hopefully branch off from there. Thank you, everybody.
Thank you. I'm all done.
Thank you guys. I really appreciate your time in coming here today. Is there any questions, any comments? Oh, Tony?
I have a quick comment. I just want to acknowledge like the emotional roller coaster that just kind of happened, starting with talking about our own colleague who passed away, and then Barbara sharing the fact that her grandson passed away from substance use disorder, and then ending with Sean's incredible story. That was just really powerful. And I just want to acknowledge the experiences and how this impacts our lives and how important this is. And Sean, that was amazing. Thank you for ending on such a high note, because honestly, I was like down in the dumps at that point. But hearing your story was just really powerful. So thank you. Thank you for being here. And Barbara, I'm so sorry. So incredibly sorry about your loss.
Oh, thank you.
Okay, Michelle, go ahead, Tony.
I was just gonna say, I don't know if there's any questions for Ari or Stephen about the program, but I think it's just a great representation of how programs like these and the other work that we're doing are impacting people's lives. So just opening it up to the 79 people here, if you have any questions about, you know, barriers, challenges, different successes, or if you want to also kind of provide space for Barbara as she's here. She showed up today because she believes in this work as well. Just throwing it out there to the group.
Amber?
Put my hand down. Okay. Barbara, I'm so sorry for your loss. You know, I lost a brother to the disease about 10 years ago, and it's still every year, you know, every day I miss him. And, you know, it's really important work we're doing. It's really important work we're doing, and people are still dying. People are still suffering. Families are still being torn apart. Like, this isn't something that's going away, you know, and it's by it's so important that work that we are doing is so important. And you know, I love hearing stories. I started, you know, I'm the peer representative here on the committee, and that's how I started out, was recovery coaching and peer support. And you know, after I got my welding certificate, I went right into peer coaching. I don't know. But you know, the sky is the limit. Like, life has been waiting to happen to you. And I'm so glad that you have the support that you have. And I'm just so proud of you. And I know, right? Isn't it such a good feeling? And you know, you get to help be a beacon of hope for others, right? And hope is just imagining the possibilities, right? Just believing that things are possible. And that's what we do in the Recovery Navigator program, is we show people that things are possible. And sometimes that's all people need, is to just believe that it's possible to even try. So thank you guys for sharing your stories and your, you know, your successes and your losses with us. You know, I just want to honor that. That's all. Thank you.
Thank you, Amber. Appreciate that. Brandy, can you comment? Did you have a comment? Excuse me.
Yeah, I had a comment. I can't think of who was speaking. She spoke for Barbara, and she was talking about how there are no recovery services and things in that area. And so, you know, just thinking definitely about how the morning's been going, everything said, are we the body to advocate for services in those rural counties? Because you can't have these success stories if there's not adequate resources. And so, what is our position on that? I can't, you know, it'd be hard to run Recovery Navigator. There's no recovery support, no housing, things of that nature. Where do we fall into that as a body in this room? Because I love the stories, but it's like, how can we be more effective? So I don't know if I shared with you or not, but when we started the Navigator program and our navigators went up to Goldendale and Stevenson and in Skamania County, found there were no services. We took our Recovery Cafe model up there one day a week and started a pop-up cafe one day a week, so that there would be some kind of a recovery place for people to go at least one day a week. And now Klickitat County is, or Goldendale is working on having their own 5-day-a-week recovery cafe, joining the network, and have their own 501c3 and do that. So you know, sending them up there has started a landslide of recovery services that are starting to come there, but there's not enough. Well, yeah, that's what I meant, Barbara. It's not you guys are already doing everything you can. I'm wondering, from this vantage point, we're on the state committee, where do we solicit funds from the state to put in effective things where you're not having to put together a recovery cafe and get volunteers and all that? It should be a resource that we're trying to do statewide if we really want to approach recovery support for people. And we're not approaching it in a way that is saying that our state wants to do something about it. We can't approach it with, you know, milk money. So that's where my head is at, and listening to these stories, or where there's not enough resources. You know, people like us are always going to get it together to make something happen, but I'm just saying it should be a little bit easier. And so where's our position, or where's our power on the SURSAC committee for leverage is all I'm asking about.
No, Brandy, in response to your question, I don't know if this committee would be interested, but we do have significant work underway at HCA regarding rural transformation. It's for healthcare abroad, not specific to, although behavioral health is a component of it. And I don't know if maybe having that group or the program manager for that work come and talk about what we're currently doing to kind of help provide a foundational piece for the conversation would be helpful or not. But that's something that we could look into. And maybe when we get into the Minty results conversation, when Michelle summarizes some of the feedback that we've received, you know, we can kind of have further conversations related to that.
Thank you.
All right. Thank you, Brandy. Appreciate that. I see, Malika, you have your hand up. You want to, actually, would you mind introducing yourself, doing your introduction, and then making your comment? We would appreciate that.
My name's Malika Lamont, and I'm the director of the Lead Washington State Technical Assistance Team. My camera is not working with Teams for some reason, so I'm sorry I'm not able to turn it on. And I'm also the director of Vocal Washington, Voices of Community Activists and Leaders Washington, and a member here on the SURSAC. I wanted to make a comment in regard to what Tony had just said and Brandy. From the perspective of this body was intended by the law to make policy recommendations, it would seem like that would be a really good, what you were suggesting, Tony. As a member of this group, I would ask that that sort of educational opportunity be made available so that it can influence the recommendations that we could make and potentially advocate for, so that it would be in alignment with other work that's happening in the state, so that we can, I love hearing the individual stories of recovery, and we need to be, as a body, I feel like it is our charge to try and create a more hospitable environment for more of this work to happen that is resourced and able to be implemented in individual communities so people don't have to leave home in order to get the help that they need.
Thank you, Malika. Okay. Do we have Jason?
Yeah. Yes, Jason.
Jason available? Okay, we're going to jump back to that. Appreciate all the comments. And thank you. So we'll go ahead and have Jason present.
I think the camera can reach you from where you are.
Oh, the slides.
Oh, yes, if you can share. Yeah. Slides you got.
The joys of having a hybrid. Let's see how this works. Going muted. You can hear me okay online? Great. Let's see if I can screen share. I'll show a few slides and remind me, Michelle, how much time we have this morning? It's like 15.
Yeah, the next item is at 9:50, so you've got 10 minutes.
And the reason
at 10:10, you've got plenty of time because we switched some things around. Yeah.
And the reason I ask is this is work that we can go on all day about. So this is pretty serious and significant work. Let me just check. It looks like our slides are showing. Thank you. And so just a sort of introductory here. What are we talking about? This is our reentry waiver. Medicaid language. The laws of Medicaid do not allow payment for Medicaid for healthcare services by Medicaid in jail. However, 1115 is the United States code that provides some exceptions and availability to states to ask for a demonstration or a pilot program to prove exception to rule and law. And so our 1115 waiver, many states have these sorts of waivers, and we're the second in the nation to actually ask for this waiver for reentry services, for a limited set of benefits while people are in a carceral setting. So we'll get into that, and that's what we're talking about here. And first and foremost, with an intent to provide, this is, I think, so important, connected to our work here at SURSAC, medication for opioid use disorder and alcohol use disorder. So that is the goal for this initiative. There are other services, so including care coordination, that's so important. So people get treatment while they're in a carceral facility, and then they're connected with treatment with a community provider when they are released. It might be helpful, and I think important too, to note there are a few other important pieces to this waiver. Tony mentioned earlier contingency management, which is
a opportunity and maybe something, if you haven't read SURSAC on, might be another good topic for a few minutes, and happy to get into a little bit of that now. But supportive housing and supportive employment, and under this new waiver, 6 months rental subsidies for a narrow set of authorized individuals. We have to develop that program still and get further approvals and agreement from the Fed, so we don't have a timeline quite on that yet. And contingency management, as I mentioned, are another one. But here is just a list of programs on the right-hand side of this slide that is a summary of the other waiver-related items that I think might be important or at least interesting for you to know. The other piece is related to what we call health-related social needs services. As you might imagine, Medicaid pays for medical treatment chiefly. As of late, Recovery Navigator program is a great example. Peer services, another great example. There are programs in that realm that Medicaid can pay for too, including a number of these services here that we can. Supportive employment, supportive housing is an example of that. Contingency management probably in this group as well. But here's another sort of list of other services we can think about, including respite care. That's important, I think, people, particularly coming out of a hospital setting and needing further recovery, oftentimes medical supports, behavioral health supports. I mentioned what we call our foundational community supports program, which is really our supportive housing and employment program. So getting into reentry, obviously healthcare in the United States isn't the best overall. We have a fragmented system and a very expensive system. And there's probably no place more fragmented and siloed than carceral healthcare, and especially that connective or lack thereof of people in a carceral setting moving into community setting. And so our goal is to connect and improve that, particularly again with regard to medication for opioid use disorder and treatment. The limited set of benefit applies in a 90-day period prior to release. And it incorporates, as I mentioned before, medication-assisted treatment, particularly MOUD, medication for opioid use disorder, and a care management benefit. Interestingly, and we already pay for medication after release, but in order to qualify for this waiver, we must show that we can provide people not only a script upon release, but 30 days, at least 30 days of medication in hand, leaving the carceral facility. And that's the basic benefit. That's the basic limited benefit. Now, it really gets interesting talking about sort of secondary benefits that CMS allows. And really that one, the big one here is the full pharmacy benefit, not just pharmacy for MOUD, but the full pharmacy benefit for everything. The trick here is that carceral facilities must prove that they can provide the full formulary benefit. So we are working with jails and prison system now to ensure that. And I'll get into timeline and details later. This also comes with some other diagnostic tools, lab and radiology, and particularly targeted behavioral health evaluation management codes. So the initial diagnosis, initial screening, and maybe some targeted follow-up if the feds let us do that. We're still working with them on some of these definitions. And that's usually where I like to pause because I might have some questions. I don't know if we have time for that today, but happy to either take that offline. Here's another view of how this will work. If at intake you can imagine you're new in a carceral facility, and there's a screening process, an evaluation process, and that's sort of in the left-hand side. And then sometime, now it gets hard to predict how this will work in a jail setting because people can be in a jail setting for very few days, for hours sometimes. So how is that going to work? We need to probably work out some processes for those very short-term stays versus a little bit longer, and then versus prisons. That might be a little bit easier to identify 90 days prior to release. And so this will be an experiment, and that's exactly what this is. We're inventing this, folks. This isn't out there in anywhere right now, any state. California has been approved as well, but they're in the same boat we are in terms of developing and designing this work. And then, as I mentioned, you've got immediately upon release some things that must happen. Not only the medication has to be provided 30 days supply, but you have to have a system that communicates what happened during the carceral facility with your community provider. And in essence, it has to be not just a referral to a community provider, but actual appointment made. And in essence, you need an electronic health record to do that work. And so that's a key piece of this initiative. And there are some other important post-release care management required services, as you might imagine. A big factor here is capacity funding. The state has, through this waiver, availability of upwards of $300 million to help local jails and state prisons in juvenile detention, juvenile rehab administration facilities to support the program, to get ready for the program. That can include a number of elements such as the IT infrastructure, the electronic health record, the billing systems, the staffing necessary for this, and as described here on this slide for you. And this isn't something that we can just turn on overnight. This isn't something that a facility can just say, yeah, we'd love to do it. You have to prove that you can do it. There will be a readiness review that will require that. And my computer's disconnecting. Let's see if that still works. I'm here in the office and I've been kicked out of our internet. It's always fun. I think I'm on still. Okay. Here's a quick timeline of what we're thinking. And in essence, what we'd like to start is for prisons and jails. And I would say early adopters. I do not expect everybody to be ready. As I just mentioned, this will be a significant readiness review to prove that you can fulfill all the requirements. July 25. Backing up for July 25, technically the juvenile services can begin in January. That's under actually the Consolidated Appropriations Act. Congress passed that legislation early last year. The budget bill from last year included a Medicaid-focused benefit for juvenile facilities. That can start January 25. But of course, we'll need some time there. In fact, CMS, this is the Centers for Medicare and Medicaid Services, our federal partner. Medicaid is that federal state partnership. It's that unique program, 50-50 sort of program from the feds, and they set some of the overall rules, and then we apply the local rules and programming in partnership. And feds haven't even provided the details of how the juvenile system will work yet, so we're still waiting on some of the details there. The capacity building, we'd like to start at least a year ahead of the July 25 time. And as you can imagine, that's a whole program in of itself, that's significant funding. So we're building that out now. Really, we're at a stage here of design and planning and key informant interviews and working on some project development in both the capacity funding project and, of course, in the actual implementation. This may be a good place to stop, Michelle, if we don't have a lot of time this morning. I'm happy to send these slides and provide them for the group. There's a few additional details on this slide set about really the importance and the detail with regard to care management. And then, again, the emphasis there really to screen, evaluate, treat or continue treating people for medication for opioid use disorder. That, if there's one thing we could do here, and that is it. So I might stop there. I don't know if we have time for questions or.
You do have a lot more time. We have another 20 minutes actually. So, but I did want to share, there was a comment and a question in the comments, in the chat. Someone said, I found that there's a lot of misunderstanding around what specifically contingency management is, based on the name not being a good descriptor. I think hearing a brief description would be great for everyone here.
Yeah, Tony, do you want to take that one, or do you want me to stumble through it?
Oh gosh, I'm pretty certain that I would stumble as well. Although I know Laura Weed and others within DBHR have been working on this along with partners at WSU and UW for a while. When we're speaking about the waiver for contingency management under Medicaid Transformation Project 2.0, speaking specifically to incentives for providing a negative urinalysis test within a specific area or in a program.
I think we're talking gift card sort of incentives, like a grocery card or something along those lines.
Right.
I mean, it's not a lot of money, but just enough to sort of incentivize.
And I think when I read that comment, I read that as a request to have a contingency management presentation for this group in the future.
That'd be great.
So I'll leave it at that, and then we'll take that back as a follow-up as well, because we do have the subject matter expertise. It's just not in this room with me that can kind of speak more efficiently towards what we've been doing through our state opioid response grant, as well as funding that came out of 5476 and State versus Blake. We did receive some general fund state to support that work, and we're working with a number of different organizations. And so thank you, Susan, for that comment, and we can try to find time on an upcoming agenda for a contingency management summary, if that's of interest.
And Tony, Caleb put in the solid research, the really amazing research to support the effectiveness of this. And then Lisa's noting Mike McDonald would be a good person to invite for further conversation about it. Thank you, Caleb. Thank you, Lisa. Any other questions about this reentry initiative and the waiver? And I'll just note we've got our public statutory public meeting related to reentry work. We call our reentry advisory work group that we meet now every other month. We have work groups that we're building off of that now, probably related. I would say one group is interagency related to prison, Department of Corrections. Probably another group related to the Juvenile Rehab Administration with DCYF, the Department of Children, Youth, and Families runs JRA. And then jails, we may need another work group and another work stream related to local juvenile detention, because they are administered separately, usually, than the jail systems. So it's quite a lift, quite a project of many projects. Any other questions or thoughts on reentry? I'm happy to spend a few more minutes if you haven't. I was just reflecting too on Dr. Mark Stern and Dr. Cindy Grande's paper. It's a couple of years old now, a few years old now, but I think they may have updated it, really emphasizing that more than half of the people who may have opioid use disorder are leaving jail, are in jail, are leaving jail and prisons. And it just emphasizing again how critical this policy is with regard to providing an further opportunity for treatment. Fortunately, we have in the legislature in Washington funded some initial work with opioid use disorder, naloxone, and so forth in jail. And you can think about this a reentry program, really scaling that work up. Oh, and I think I see a hand up. I cannot see who that is.
It's Malika. Malika, go ahead.
Yeah, hello.
Hi, Jason. Thank you for your presentation. So I'm wondering, so in the last legislative session, we saw that funding for medications for opioid use disorder for incarcerated people was not fully funded. And at the level that it had been before, it was actually decreased. And so with knowing all of these things, was that in preparation for what's going to happen with this, as far as like what's anticipated to happen? And what moves are being made in order to increase access, especially since we increased the criminal penalty? Is this, when I say we I mean the state, that criminal penalty was increased for simple possession, so more people are going to be incarcerated. So like, what is being done to make sure now, because the implementation of this waiver isn't going to happen until next year, what's happening so that folks can get increased access to treatment now, when they're incarcerated, inevitably?
Malika, I know we have a decision package to fund the existing funding. I think, I don't want to speak to the financial details. I'm not exactly sure I understand if it was lowered, or maybe some of that was COVID dollars or otherwise settlement fund dollars from the opioid settlements. So there have been some back and forth on that. But in essence, we are trying to fund an interim program until this is up and running. That funding probably will not suffice for a full statewide program, but I've actually been impressed with it to date in terms of the take up of that program, because as you can imagine, it can be hard to offer a full menu of opioids, particularly methadone, now Sublocade, but there really are good options for jails, and I've seen some good results of that. So we're asking for that funding now until the waiver can kick in, and then some phase-in period, because again, not all facilities will be qualified, will have gone through the readiness review processes on July. I think only a few will, and then that will grow over a 2-year window. By the way, what we expect to do is about every 6 months, do a re-review or a further review of those carceral facilities who are interested, and do a sort of a readiness review for every sort of 6-month window to begin the next cohort of groups over a 2-year period, is at least our vision as we've described with the federal partners in our waiver material. So thanks, Malika, for the question. I think we could probably follow up on the financial details if necessary. I'm kind of looking to Michelle or Tony to see if we can validate what our decision package does and what's happened.
Yeah, I mean, it's speaking specifically to the MOUD in Jails program that was funded back with 5476, a combination of 5476 funding and biannual operating budget funding. There was some funding that was shifted, and so we had to shift money to the later end of the biennium. And then so I think the current level of funding mirrors what it was originally. But if you look at it per like a supplemental budget, we did have an uptick in state fiscal year 22. But the state fiscal year 23 and 24 funding is where the current level in which we were funded, which is $4.5 million a year. But to Jason's point, the decision package that was submitted was to expand to another 19 jails. So we currently fund 18 and 19 jails with the funding we have. And then the decision package was picked up in the governor's proposed budget. So it's included within at least the governor's budget. And then we'll have to see how this supplemental budget lands to see if there's any additional state resources for the current MOUD in jails program, but also want to acknowledge that through our state opioid response grant, we've been funding MOUD in jails with at first 5 jails, now 4 jails. And there's a lot of local work in this area. And I know that there's been local dollars and criminal justice treatment account dollars really supporting the expansion of SUD and MOUD treatment in jails. And so I think it's just a great foundation that we have already across Washington state, especially compared to other states in terms of the breadth of resources that are available in some jails, not all jails, but it'll be interesting to see how the waiver kind of expands, enhances, and also hopefully frees up money in the future as we can start to hopefully leverage the CMS federal Medicaid dollars for some of the services that we're currently providing across the state.
I think maybe, Tony, on that point, don't presume you have a clue how Medicaid works really, but it's again 50-50 if you can imagine. 50% of the dollars come from the feds, 50% come from the state, and actually it's more generous than that with Medicaid expansion in the mix, which is a 90% federal match versus a 10% state match. And so right now, all of those dollars paid to the jails, as Tony mentioned, are all state dollars, 100% state dollars. In the future, they will be matched with those federal dollars under this waiver. And so that money will then be reinvested in the system to help pay for pharmacy and all the other related items that this waiver requires. Waiver has a decision package as well, independent of the jail MOUD package at the legislature now and in the governor's budget. And substantial. It's a substantial state investment, as you can imagine, highly, promising in terms of financial effectiveness, not to mention the clinical, medical, social importance.
Any other questions?
Don't see any in the chat. All right. Shall we on to the next item? All right.
Thanks, Jason.
Yeah, thank you, Jason. All right, so in this next item, I just wanted to go over what we've done so far with the Menti results from the last meeting's Menti exercise. So there were several questions that covered things like prioritizing items from the SURSAC plan that have been funded or otherwise supported for implementation. And ideas for improving engagement among committee members and that sort of thing. So I'm just going to go over what we're doing with that information. So first of all, and you don't need to change that slide yet, with the priorities that you ranked with, that was in categories of outreach, engagement, diversion, treatment, recovery, support services, and data. I've taken the high priority items that you identified and made sure that those have been assigned to an agenda somewhere during the year. So I'm going to share that outline with you before the next meeting so you can take a look at like what 2024, the whole year, rest of the year looks like in terms of what is in the agendas to make sure that we're covering those top priority items. And so you'll have a chance to review that and provide some feedback around that as well. There's only 2 items per agenda because I know that we'll need to have room for walk-on items and other things, areas of interest that come up. So hopefully that will retain some flexibility. So I just wanted to mention that before we get into the rest of these Menti results. Okay, Alex, you can go ahead and share that. Oh, is it? Oh, it is sharing. Okay. All right, next slide. So for items that there's a lot of things, right? There's the parts of the plan that we really need to cover and get your advice and guidance on implementation around. And then there were many other things that there has been committee interest in discussing. So not all of it can make it onto an agenda, but we want to make sure that we're still sharing information and keeping one another informed around those various items. And so one of the recommendations was to have something like a Slack workspace or something like that, but we can't use Slack. But what we do have is a similar resource, not in terms of messaging, but just in terms of information sharing, called WA Portal. So I have started the process of making a SURSAC WA portal for us. So information even information that is included on agendas, that will be a hub for all of the topics and projects, programs of interest to the committee will start to be collected there for information. And so in between meetings and whatnot, if you want to have get up-to-date information or look for a report of some kind, if you want to send information to me to post on WA Portal, I can do that. So it doesn't all just have to be coming from HCA. We can post other resources from you. So that will become a new information hub for the committee. Next slide. All right, and so as far as improving engagement, these are the recommendations that we received that we can take immediate action on. So I just want to let you know what we are doing with those. So replacing SURSAC members not attending regularly. After 3 uninformed absences, I do a check-in with members to make sure that they are still interested in serving on the committee and that the thing preventing them from attending so far is not a recurring issue. If it is a recurring issue, then we do go through a process of recruiting for someone else to fill that seat. So just want to let you know that's the current process, and so we do have a system in place for that, and we'll become more diligent around that so that we retain high engagement. Providing agendas and supporting documentation with a few business days to review and form questions. So agendas, a draft agenda is provided at least 1 week ahead of the meeting for input and review. And then there's a couple days for that input, and then I integrate that and send out another one, usually Thursday morning. If that's not sufficient time for the final agenda, please let me know. I will do my best to get it to you sooner than that. So just, if there's additional feedback around that, please let me know. If there will be surveys and polls conducted during the meeting, send the questions ahead of time and make sure people know where to find references to help inform their responses. Absolutely, I hear that. If there are more surveys and polls, I will make sure that you have those questions ahead of time so you can prepare your answers and inform yourselves in advance. Let folks know ahead of time before the meeting what there will be open discussion on. So again, yes, I will make sure to do that, and I hope I have done that satisfactorily for this meeting, sending the mentee responses and helping you prepare for this. Use interactive sessions to actively involve participants. Yes, we can use more mentee. If you have other ideas for what interactive means or other tools we can use, I'm certainly open to those suggestions. Give participants the opportunity to discuss themselves and their individual work. Yeah, so that is part of what walk-on items can be. So if you want to bring that to the meeting, if there's something in your line of work that you want to discuss or inform the rest of the committee members about, the walk-on items would be a great space to do that. And entertain subcommittees. So yes, we are willing to entertain subcommittees. As I mentioned in the last meeting, there are some capacity limitations because of the other work groups that are happening as well this year, but it doesn't mean that we can't have any, even if they need to be ad hoc. We can certainly have additional meetings or subcommittee meetings on specific topics. I'll just need you to let me know what you want to use those subcommittees for, and when you want to be having them. So if that was an idea that you had and you have more to say about that, then I'll just need a bit more information from you for what to do with that and when. Open a secondary platform for communication such as Slack or Signal. Again, we're going to start using Law Portal for this. And I'll just actually pause there in case there's any questions about the ways that we're taking action on those items. Okay. All right, next slide. So the next several slides are going to ask for your clarification before following up on these items, because I didn't want to make any assumptions or misinterpret your responses. So I just want to make sure that I'm getting enough information about these requests that I can make a meaningful follow up in a meaningful way. So one of the themes was for more follow up after meetings, a follow up survey after every meeting, a feedback loop. So my questions for the committee members are, what type of follow-up does this refer to? What would you like to see? What does a feedback loop mean in this context? And what would be the intent or purpose of a follow-up survey after each meeting? What questions would you want to be asked in such a survey? So if you were someone that submitted any of those requests or you agree with them, then now's the time to help provide some clarification. Otherwise, I'm not sure how meaningful my follow-up could be around this. Go ahead and raise your hand if you have any feedback from me on this. Yeah, Malika, go ahead.
This wasn't my suggestion, but I do see where it could be helpful to, I think that asking some finite questions to be able to give HCA feedback around facilitation, around engagement with staff, and also some other, and the way that the meeting was arranged, organized, and conducted. I think that those could be some really, I mean, we have some really great evaluators on here, Caleb Bantagreen. Anyway, but which this is like below you, but but I think that it could be interesting for folks to be able to provide feedback in the moment after after meetings occur, and also that there would be a text box to be able to provide written feedback, and that it would be kept as part of the record related to these meetings.
Thank you, Malika. That's really helpful clarification. So what I heard there was to ask questions after each meeting about the facilitation of the meeting, engagement with staff, the organization of it, how it was conducted, and then have a write-in text box for written feedback that's more open-ended. Great, thank you. Anybody else have additional ideas around this item? Okay, next slide. So for committee membership, there were a couple comments about opening up to new members and wanting more diversity. So my questions for the committee around this one are, like, what new seat or area of representation would you want to add for a new member? You can refer to the committee roster to see what the current subject areas and geographic areas of representation are on the committee. And then also, what is meant by diversity in this context? Like, what groups are underrepresented in the committee? Are we talking about racial diversity, geographic diversity, more LGBTQIA+ members? It can mean a lot of things, and so I just didn't want to make any assumptions around that. So if there's additional input here, like to open it up. Yeah, Deontay.
Hello. I think it would be important to hear. I mean, other people who are non-members would chime in and say what they don't see. But I think it's important to hear from. I think it would be important to hear from all the members of SURSAC what don't they see, because they are the members, right? I would love to hear their insight. And also you, Michelle, too, like, what don't you see?
Yeah, Deontay, if I'm understanding that comment correctly, is there a distinction to be made here between, you know, areas that folks represent as kind of seen on the roster and who's speaking up and the perspectives that are being vocalized that we're hearing or not hearing?
Perspective as well as members. I know you were saying, you also touched on like members of the SURSAC that maybe either stepping down or you guys want to bring more diversity, but what does that diversity look like to the members? I think would be interesting to hear.
Great, yeah, thank you, Deontay. Hunter.
Hey, good morning. See, personally, I think it'd be cool to hear from more law enforcement around the state, or like legislators, just in terms of what's going on in other districts, what's working, what isn't working, what may have people skeptical of drug policy reform, or like even people who like they don't even have to be law enforcement, just people in general who may be skeptical and could ask us challenging questions, and I could try to be of help to recruit people to come comment on these things, because I know I've seen a lot of skeptical talk on social media that these policies won't work or they're just enabling or something. But there's a lot more to these policies, obviously, that we get to talk about in here that most of the public isn't aware of. So yeah, that's my 2 cents.
Thank you, Hunter. And to Deontay's point, yeah, are there any other SURSAC members that are, yeah, go ahead, Malika.
I think all of the areas that have been mentioned would be good to have, folks represented in the group. To Hunter's point, I think that it's good to have folks that do not agree to be a part of the conversation, because it's not to be, it's not supposed to be an echo chamber. I also would hope that, I don't feel like I know very much about the other folks in this group except for the people that I know. And so I don't want to erase the diverse perspectives of individuals that are a part of this group, because I don't know enough about everybody to say a thing or not say a thing. And I'm actually surprised sometimes with certain people that agree with something that I say, and I'm like, oh, I wouldn't have thought that, just based on what I don't know about that person. Anyway, so I think that it would be good for us to have a broader understanding of who is part of this group, and then open it to all of the diverse perspectives that have been mentioned.
Yeah,
and
thank you.
actively recruit people. One of the other things that I didn't mention this, sorry, related to the evaluation piece, or not evaluation, sorry, even though it is an evaluation, the survey piece. I think that one of the things that has been concerning to me is that leadership of this group has been decided by not the group. And I think that from a process perspective, it would make better sense, in my opinion, in a more diplomatic sense, or I mean, democratic and diplomatic sense, for people to be able to, the people within the group, to decide who the executive sponsors are, who the chair of the group is. And if we are bound to have a chair from the healthcare authority, that from a process perspective, the group gets to nominate somebody that has equal power, that is a chair from within the group.
Thank you, Malika. Yeah, I'm writing that down. Yeah, thank you. Addie, go ahead.
Thanks. I just want to underline what Malika said about not knowing who's in the group and what perspectives they might be representing, especially when it comes to identities people might hold, like LGBTQ, BIPOC, lived experience or living experience. I feel like it's really important to know who's here and what identities they're bringing, and also acknowledge that people may not feel comfortable disclosing those identities in this committee for various reasons.
Yeah, thank you, Addie. Malika, go ahead. Yeah.
A follow up on that. I mean, I agree with you, Addie, that folks may not want to disclose all of that. I know I don't want to in the context of this recorded meeting, but that as the convener of the meeting, HCA take into consideration what it would mean to have some actual community building opportunities for folks within the group, so that we can, to me, the best policy occurs when from groups like this, when people actually feel connected and invested in the work. And that doesn't just happen in a 2-hour long recorded meeting. That happens through intentional community building.
Any other thoughts about voices that we're not hearing from, perspectives that have been missing? Just checking the chat real quick. All right, next slide. All right, so for agendas, there was feedback that clear agendas with lots of information are needed, include the participants in agenda building. So my questions for the committee around these suggestions are, how would you like to be included in the agenda building process beyond receiving the draft agenda and providing input via email? Based on what Malika had said earlier, it sounds like maybe it would be helpful to elect somebody to come to agenda meetings. Not sure if that's a correct interpretation or what, but there's that question. And then there's what would make the agendas more clear. And if you have any examples of additional information that would have been helpful to include prior to this meeting or a past meeting, just so I have a sense of what is meant by that, that would be really helpful as well.
So this is Malika. I didn't raise my hand, sorry. But I don't think that putting it all on one person is the way that you get a robust agenda. I think that we have time in these meetings, or at least it seems like we do, where we could maybe contribute, like we've provided feedback through Menti and through other means of saying that these are topics that we would like to explore throughout time of doing these meetings. So it seems like there could be a review process at the end asking folks what they want to see from this list of things that we have provided on the next meeting. I don't know how the rest of the group feels about a process like that, but to me, it feels like that's very doable and it doesn't just put it on one person.
Yeah, that's a great idea. I think just logistically from my perspective, I'm not sure how to arrange that. Like if we would, I mean, there's like 30 different items that we would need to narrow down to a couple for the next meeting. So that process gets, from my perspective, gets a little bit tricky, but maybe there's something we can do with the outlines that are provided throughout the year, and maybe looking at, like, if I can be one agenda ahead during each meeting, so you have the one for this meeting, the draft agenda for the next meeting, and then we can take a look at what's proposed a month from now and fine tune that together at the end of each meeting. Would that be helpful? And not just asking Malika, but asking everybody. I see it. Okay, great. Great. That's really helpful to know. Thank you. Okay, I think we're ready for the next slide. All right, and then some of the feedback for between meetings, more transparency from the HCA, better treatment of those who are trying to share, community outreach, attend other events, get out to leaders, reached out to community-based agencies about SURSAC and our desire for people with lived experience of substance to describe their specific needs and practice recommendations. So that those were the some of the feedback that we got around under the theme of between meeting activity. So my questions for the committee are, what would more transparency mean specifically? Like what do you want HCA to do differently to create more transparency? What could HCA do differently to provide better treatment to those who are trying to share? And should the invitations to people with lived experience to attend SURSAC meetings and share their needs and recommendations come from HCA and or from SURSAC members who work with peer-run and outreach-focused programs? So if you have thoughts on any of those questions or other clarifications around the feedback provided, that would be great. And Kevin, I'm reading your comment now. Okay, great. So yeah. Kevin. Yeah, Malika, go ahead.
So it feels to me like, I mean, that regarding the transparency and such, when like the group we participate in, like sharing what we want to see, and then what gets translated into a document and how it's arranged and what's communicated. And then we're not always given full opportunity to engage with those documents and timely before the next meeting. So being able to get those documents at least, 2 to 3 business days ahead of time of the meeting so that we can review them would be really helpful with increasing transparency. And also, and these are just from my perspective, this was not my recommendation, but this is just my recommendations related to the recommendation, that data is collected and shared in a more transparent manner statewide, and but it sounds like that's something that's going to get worked on. And let's see here, having this particular, I think that it's a good recommendation as far as like community outreach to attend other events to get other folks engaged in this process. I feel like it would be potentially a good opportunity for HCA to work with the members of this group to identify events and that may be occurring in our communities that we could help be like the, I guess, water carriers for the work of this group to get further engagement. And also, like it's same related to the community-based agencies about SURSAC and the desire for people with lived experience to participate in the process. And then related to how folks get treated, I think it's going to be really important that HCA staff and processes related to these meetings and the meetings, the work group meetings that potentially could be happening in between, is trained on how to work with folks and that have lived experience to be respectful and responsive to people, and recognizing that when you're dealing with community, period, being flexible in agendas and engagement is a requirement for working with the community. You can still facilitate a meeting without being rude or disrespectful to people that aren't following your exact agenda. So that's, to me, from a making policy more accessible to everybody, those are things that would be important things to think about. And maybe have HCA staff engage in and maybe the whole broader group, some formal training around what it means to have community created policy.
Malika, would you say that that has improved in the past 6 months or so at all, or is it same as, I don't know, I guess I'm speaking like for my own facilitation. If you have feedback for me personally, if that's improved at all, I would really welcome any feedback, and that doesn't have to be shared at this meeting, it can be over email. And that goes for anybody. If you have specific feedback from me, I'm always open to hear how I can be doing better in that way, so thank you. Anybody else have thoughts about these questions and how we can improve transparency, reach out to community-based agencies, any of this on the slide? All right. Next slide, if there is one, that might be the last. It's the last one? Okay. All right, well, that was incredibly helpful. Thank you so much to everybody who provided thoughts and ideas around that. I have many action items to follow up with now, so I really, really appreciate that. And there were no walk-on items, right, Blake? So we don't.
Do you want to take another shot at public comment?
Yeah, that's a good idea.
We have time. Okay.
Yeah.
Does anybody from the public have a comment? If you do, go ahead and raise your virtual hand and we will call on you. So again, calling again for public comment if there is any. All right, last call for public comment. All right, Michelle, you want to wrap it up?
Sure. There are several next steps, one of which will be I will start to provide the next meeting agenda at the end of each current meeting so that we can review that together. I will also send the 2024 agendas outline to everyone before the next meeting so you can see kind of what's in store over the next several months. We will look into getting a presentation around the rural transformation work at HCA to SURSAC. I'll get the 115 waiver slides from Jason to send to everyone. We'll look into getting someone to present on contingency management and see if we can get the decision package details for the funding for the treatment in jails before the 115 waiver kicks in. And there are several other things here, but I will do my best to follow up with all of those and let you know what's coming up for the next meeting. So I think we will wrap up early. And thank you all for being here. Thanks for your engagement. Thanks for all of your ideas and for all the good work that you're doing out there. So thank you. Have a great week.